Can you lift heavy things with scoliosis? Every case of scoliosis is unique with its own activity, recommendations, and restrictions. So if you know you have scoliosis, you definitely want to consult with a specific provider regarding your own restrictions. But in general, people with scoliosis can still lift heavy things. They can still perform weights. They can still do exercises. But however, they must be mindful, particularly of how to lift, because a patient with scoliosis potentially could be exposed to a higher risk of a problem or injury. So lifting items evenly is really the key to preventing problems. You want to keep things more symmetrical. When we look at heavy items and how to lift them and how not to strain the spine, this is a general rule for really most any patient with or without scoliosis, that the back should be kept as straight as possible. If we go down to pick something up, we should bend at the knees, not really at the low back. And objects being lifted should be held as close to the body as possible. You should always try to engage your core while you're lifting, contracting your abs or your low back, and using your legs rather than your back to lift. And then when you have the item lifted, you don't want to be twisting from your torso or rotating to put objects up or down. You want to turn from your feet and move your whole body and face the direction where you'll be placing the item. And this type of approach can provide the most symmetry while you're lifting something, as opposed to, just bending at the back and twisting and turning. Now, when we look at people with scoliosis, we look at activity restrictions and what things patients with scoliosis have to be concerned about. And one thing that very often comes up is that patients ask me can they lift weights? And when we look at activity restrictions, like I mentioned, they're very case specific. Patients with scoliosis generally can be active weightlifters. They can lift weights and they can do exercises and they can be deemed very, very safe. However, for some other patients, depending on how they present, it may deem unsafe for those other patients. But in general, when we look at a patient with scoliosis, the more severe their curve is, the bigger the numbers, the more complications they have there with their scoliosis, the more pain they experience as a result of the scoliosis, the more likely they're going to face activity restrictions associated with their scoliosis. When we look at weightlifting typically involves lifting weights, but the most one we are the most worried about is anything that adds compressive forces to the spine. So things like deadlift or lifting weights over your head or squats that have a bar on your shoulders. These are putting more compressive forces down into your spine, which potentially could aggravate people with scoliosis because of this type of extra compression. Now, in some cases, this weightlifting can be totally fine and no problems, and they can perform these things, and where other cases, this may not be found suitable. Now, core strengthening can be an important case when we look at patients that have scoliosis, but we understand that patients that come in with scoliosis don't have a weakness problem. My average adolescent that walks in my office typically is a 14-year-old, 13-year-old female that's an avid gymnast or dancer, and they're normally very strong. So it's not weakness that causes scoliosis. However, keeping the body strong can help prevent patients experiencing symptoms associated with scoliosis. And these symptoms could be associated with back pain or stiffness or soreness, especially in the adult form. So since scoliosis causes the spine to bend and twist, we know there's going to be asymmetrical muscle tone associated with this. The stronger we can maintain these muscles, the healthier we can maintain the function of these muscles by maintaining and supporting normal alignment, the better off this patient is going to be. So when we look at the surrounding muscle tissues, we know some areas are going to be unbalanced, other areas are going to be stronger, other areas are going to be weaker. Sometimes they can experience excess movement in one direction, not in another direction. And the idea of maintaining this normal, healthy alignment is something that's very, very important. And when we look at physical therapy, typically we're associating scoliosis physical therapy or exercises as an asymmetrical exercise that patient we're going to be performing. And one question that gets asked a lot too when we look at is, can being strong stop my curve from worsening? As far as we know, general strength has no effect on curve progression. So therefore, just being strong isn't going to stop your curve. But asymmetrical scoliosis exercises can have a dramatic impact because we're addressing the spine in an asymmetrical manner. So therefore, improving muscle tone in a patient with scoliosis isn't just general strength. It's improving the balance between these muscles in an asymmetrical manner. And this is where strength training may be appropriate for this type of person. Also, spine-friendly lifestyles, including like activity levels or activities that can be for patients with scoliosis, help stay fit and can stay healthy, is very important, because we know staying fit has other health benefits other than just scoliosis. So when we look at a spine-friendly lifestyle, this is something that we would also consider a scoliosis-friendly lifestyle if a patient has scoliosis, is really finding the right activities and the balance between activity, health, and well-being, because we know staying fit, having fitness associated in your lifestyle is very important, because there's a lot of benefits outside of just a healthy spine. However, we should know that there'd be certain activities that we want to kind of consider could potentially cause a problem. And when we look at activities, activities can cause problems, they're going to be normally activities that increase compression, repetitive impact. Things like horseback riding, things like, contact football, gymnastics, potentially things that are one-sided, like bowling with one hand or tennis. Now, this is not always true, but for some cases, if you want to be ultra careful in terms of what's happening, these are the things that we'll be looking at. Now, exercises that are considered more safe, you would say, are going to be exercises that work the body more symmetrically and work the body with less compression. Now, no activity should ever be attempted without clearing it with your scoliosis provider. However, swimming is a symmetrical exercise that's non-compressive. Biking is a symmetrical exercise that's not compressive. Rowing is an exercise that's not compressive. Maybe certain things like yoga, Pilates, could be walking. These kinds of things that are not compressive types of exercises can be sometimes the safest types of activities for patients with scoliosis to perform. We know patients with scoliosis can be just as strong as healthy patients without scoliosis, but one thing we're concerned about is things that increase compression. So when it comes to lifting heavy objects, normally it's not an issue, especially when lifted properly. But as patients have more severe cases and they have more impacts as a result of their scoliosis to their activities of life, this is when we should consider maybe avoiding and lifting heavy objects, because it can cause potential strain to already vulnerable spine. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.